Hi everyone, my name is Matab Mansour. I'm a dentist from Washington. I did my undergrad at University of Toronto in Canada, then moved to Washington, and recently I did the Adex exam, cdca exam, because I have a plan to move to California. So for over there, I had to do this exam. Washington didn't need any exam for Canadian dentists. So I did this exam, and although I have been dentist for 5 years almost, and I do lots of crowns, restos, and pretty much everything that is covered in the exam except the root canals. But this exam was very stressful for me because, like, in Canada, we didn't have this exam, so I didn't know what to expect. At least here, like at school, I know that the instructors and school in general make you a bit more prepared for these type of exam. So I wanted to make this video. I don't have experience in making videos, but I wanted to give you some more information, so hopefully you don't need to go through all of this stress that I had. And thankfully I passed the exam. The first time that I did it 2 weeks ago. So I will go over the detail with you. So the exam had one part that was osce, which, like, you basically do it in a prometric center. It's a online exam. It's like on the computer. It has some multiple choice and some fill in the blank. So basically for that one, I would suggest to search like, how do I get prepared for Adex, cdca, like osce, and then you will find all the links that you need in the Reddit. So you will have some sample questions. Those are very, very helpful. The exam was very similar to those questions, and one part that I was not really prepared for that, but there were some questions on it. It was about like perio charting and some more details on it. So I would suggest you just take a look at the attachment laws and those kind of information beside those questions that you get ready. And then we go to the actual exam, which is the perio, prosto, and endo in one day. And then the second day will be full day of resto. So for those ones, I had to move to go to California and do my exam there, because I was a student. I was a student from, actually not from their school, so I wasn't from like American schools. So I was graduated already, so I had to find a school that they accept international students. So basically California, in USC, it had the closest date that I could find, and it was pretty close to Washington, so I decided to do my exam over there. I booked the hotel just beside the USC school, and I did my exam in 2 days. So the first day, like, it was a Saturday, I did the prosto, endo, and perio, and the exam was about 7-8 hours. I would say it was around 7 hours. Yeah, because you had 4 hours for prosto section, then you had a break for like half an hour, and then you had the endo section. You had 3 hours if I'm not mistaken, and then 1 hour for perio. But you know, I finished my prosto section sooner, so I did it in about 3 hours, and then I took my break. It was optional, and then I came back. I did my endo. Endo took about 2 hours, and then perio. It took me 40 minutes. So I finished a bit sooner, and then the resto was 7 hours in total, and we didn't have any set lunch time for resto. So basically, you had to eat your lunch during those 7 hours if you wanted to take a break or anything. And I would say that the instructors were very helpful. Most of them, like 80-90% of them, they were very nice people. They really wanted to help you, but at the same time, obviously they couldn't like help you too much. But at the same time, there were some that they were a little bit tricky people. But anyhow, most of them were very nice. And so if I want to go over like how those 2 days were, we started at 6:30 in the morning. So the first day that we had the prosto, endo, and perio, the start time for the exam was 8, but 6:30 we could go there and set up our stuff. So I would really suggest you start at 6:30, like you go there for 6:30, because if especially you are like me and it's been a while that you haven't worked with mannequin heads, it's really good to start like soon, so you ask other people how like the mannequin head works. And because you know, compared to my school, University of Toronto, their school was really fancy and they had like new stuff, and it was really nice. But you know, I didn't know how to work with those. Even I didn't know how to work with overhead lamp. So it's good to go there early. So first, like, you need to look for the seating chart so you know exactly where you are sitting, and then you just bring ID with yourself, and obviously all the stuff that you need for the procedures. And you know, if you forgot to bring something, don't really panic. That happened to me and I was like panicking really bad. But you know, actually you can borrow from people around you, and usually like they are very nice and they will share with you. And what else? So you go and find the seating chart, and they will give you the stuff that they are supposed to give you. So the typodont and some forms, and there is like few papers that you need to fill, and then a paper with all the QR codes that you need. So you take all of that, you go to your station, and then you start setting up. I would suggest to punch your rubber dam ahead of time, and then also make your putties for sure before the start time. You can make the putties outside of, you know, the mannequin head, so on the typodont, in that 1.5 hour that you have. But if like it's 8 o'clock, then you cannot do it outside of the mouth. So basically then you have to use all the PP and stuff to make that putty. So I would suggest you start making the putty, because like you will need 4 sets of putty for prosto sections. And then, you know, be very organized and clean in your working station, because you know, during the exam you're already stressed out, so you don't want to not know where you put like something, or like you cannot find something, so you don't want to waste your time on that. So, and also I would really suggest to have snacks with yourself, so that like when you get a break you have a snack, because it's a long exam and you want some, you know, sugar in your system. And then you know, I got the QR code and I was really confused, like which QR code goes to what. So there were 3 sets of, you know, stickers. So one is like there were 2 stickers on the top that it had your pictures on it. So basically that one is to put on your gown, and some people didn't even put it on their gown. And then there are some tiny QR codes, and then there are some larger QR codes. So the larger QR codes actually goes on the forms, on the paper forms that you receive, and it says candidate ID, and it has like a space that you actually put that QR code on it. And then the smaller QR code actually for those you know, sections of the typodons that are for the upper arch, basically you use that. So like on each section, because you have like a section that is for the bridge, and then a section in the front, and then section on the other side, like for each section you put one of those tiny QR codes on it. And then you have the perio arch also. So for the perio arch, because it's like a full arch, you put the bigger QR code. So that was something that I didn't know, but I asked other people. And then okay, so we go, like we set up everything, and then like they say that okay, now you can start. So we start with the prosto. So everyone start with the prosto. For prosto section, I would suggest you start with the bridge. And when you start with the bridge, I use the technique and what I learned from Stevenson, you know, Academy. Dr. Stevenson has like a channel on YouTube, and like he really teaches well on YouTube how to do your you know, crown, bridge. It's really nice. And for the measurements, basically you know, there is one website that actually I got subscription from it. It's mydentalkey. It's very helpful, especially for all the measurements. So you know how much to reduce, you know, on the vocal, lingual, and like everything about, you know, those reductions. And it has really nice pictures. So just keep in mind that the only material that you can bring to the exam is the manual, and you know, anything like official from Adex website. So you can print them, and for sure print them and bring it to the exam. And then you can make notes on it already, like at home you can make any notes on it, but like a handwritten notes, and just like on that same paper. Don't bring extra papers, because you know, like I did some drawing. I basically copied, like I draw it myself, like some of the pictures from mydentalkey on that papers from the manual. But there was a guy in our group that basically he printed like some pictures that just had the same measurements, and it was basically the same thing. I just draw it myself on the paper, but that poor guy, he actually printed those papers. And I think some instructors were not happy, and then I saw they were taking some pictures of like his material. I don't know what happened, but I would just say don't risk it. Okay, and then you know, I had all the measurements, drawings, and make sure you make a good putty. Don't make it too thin, that is like flexible. When you make it thick, then it's very solid and you can do like your measurements on it really good. And yeah, basically the prosto section for me was the easiest section, because like regularly I do loss of crown and bridges, so I was very comfortable. I would suggest definitely for the interproximal areas you use very skinny, like for example chamfer bearer, like a long skinny ones. And Dr. Stevenson explains it very well, but like move it like a sawing motion so that you don't touch the other tooth. A little bit of touching, as much as it's just it's a tiny scratch, is fine. You will be fine. But if it's just very tiny, so, and don't expect that you can put a fender wedge in between the teeth so that you don't touch the other tooth, the tooth beside it, because basically I was not able to put any fender wedge between the teeth that I wanted because the contacts were super tight, so I couldn't fit anything over there. So I was just super careful to do it very slowly. So after you are done with your prosto section, like with both of, like with the bridge and with the crown, then you just ask one instructor, tell them that you are done. They have to write it on the paper, like they will give you a paper at the beginning so that they put your start time, and then they put like what time you finished, so they kind of track it. And just one area that I heard many people they miss it, and they fail because of it, is because of the lingual reduction on number 9 crown. So make sure you double check everything, and I would suggest after you finish the prosto section, before you tell them that you are done, you actually go over, like print the criteria sheet that they actually put it in Adex website, and then you actually go one criteria at a time. You check it on your mannequin head and typodont and make sure you are okay, then check the other one and then the other one. And yeah, that's about that. So then I took a break myself for about half an hour. I was like feeling very well after like I took a break, so I had the energy to start the endo section. So for the endo section, I was actually very nervous because in these 5 years that I worked, maybe I did 2-3 endos in total, and I don't like doing endos. So I didn't know exactly what I should do, but based on some videos that I watched, I decided to do hand files. Like for number 8, I decided to do hand files, which I think it was a good decision because it was pretty fast and I didn't need to bring the rotary or wave one or like whatever that people will use. So just make sure it's a good hand file, because I got those hand files actually from our office. Those were the hand files that our endodontist used, but I thought like the hand files wouldn't be that different, so I ordered some from Amazon, and when they came, oh my god, they were awful. Like they were very brittle. So make sure these are good hand files. they shouldn't be too thin. So you know, they should be like the ones that they have like a nice taper. They are a little bit, you know, you can't tell the material is good or not. So I use the hand files. Basically it's a fake too, so you really don't need irrigation. So, and you don't use sodium hypochlorite to clean the canals, and you don't use RC prep because basically it's a wax. So like you can just clean it with regular hand file. So I use the hand files one at a time, like from size, I start from size 15, going up to size 40. It was and you know, for the working length, almost everyone has the same tooth. So the length of the tooth is about 24.5 millimeters. So I put my working length as 24.5, and you know, I hand filed it till size 40, and I cleaned it just with the gauze and alcohol. Like I cleaned my files and went to the next one, and then when it was size 40, then I tried my gutta percha on size 40, and then I realized that it's not going to my working length, so it's going actually shorter. So then I was thinking, like, the criteria for this exam was to at least do to size 35. So then I tried the gutta percha of size 35, and then it was going all the way down. So instead of size 40, I decided to go to size 35. And then what I did, it was just a single cone that I used. So I got that 35. I made sure that it goes to the working length. Then I got like till 14 millimeters, because 14 millimeter is the root, and then the rest of it is the crown. So I cut till 45. I dried the canal, like, because I irrigated a tiny bit with water before, so I wanted to make sure it's dry before I actually use the sealer and the gutta percha. So I dried the canal, and then I mixed a little bit of a sealer. I placed my piece of like 14 millimeter of gutta percha in the canal. I pushed it down, and I used endo plugger. Don't use the probe that is marked to, you know, check the canals or like push these, because when I was practicing I did that once, and the probe actually in that marked area, it broke. So you definitely don't want that. Use endo pluggers, and then push it and make sure it goes all the way down. And then what I did to make sure that actually it was going all the way, because you never know when you place it there, did it go all the way down or no. So it was already cut, but I used the other piece that I had, so the remaining piece of gutta percha, and I placed it on top to make sure again it's at the working length. Although it was broken, but you know, it's like pieces of puzzle that you put side to side, like on top of each other, and then you realize that, oh, it went to the working length. I hope it makes sense what I'm saying. So basically after that, you just take a micro brush with alcohol and clean up the sealer that is like that, you know, you rubbed it in the you know, chamber, like in the pulp area. So you just clean it, and you don't need to put anything else on it. Basically that's it. So when you look at the tooth, you basically see that, you know, the chamber is empty, and then you have top of your gutta percha over there, and everything is clean. So that's with that. So I decided for the endo to do number 8 sooner, like at first, before doing number 14, because I thought maybe it takes a little bit of time for the sealer to dry and gutta percha to attach to the tooth, like to stick to the tooth. So I didn't want to, you know, give it for like marking or anything, because I was afraid that, you know, the whole thing will come out if I just do it at the end. So it didn't get the chance to, you know, set. So I thought like maybe I do that first, and then I do the you know, pulpotomy for number 14. So and for like the root canal, you know, for both of the endo treatments that we had to do, I really suggest, like I watched some videos. I hope I can find it and put a link. So they were very helpful. So the big point was to actually draw the outline first. Use like one of those red blue pencils or pen or whatever, to draw the outline of axis first, and like get all the measurements done. So you basically cut through the painting that you have on the tooth. So that makes it super easy. And that person who did the video actually showed that he was marking the marginal ridges with the pencil too. So clearly you could tell, like if they say like it needs to be 2 millimeter from like the incisal edge, for example, so you exactly can see it, so, and you can measure it. Okay, so we get to the axis opening on number 14. That part I almost had a heart attack because I couldn't find, I believe it was the mesiobuccal canal. First of all, I started drilling, and I knew that it would be about like 4 or 5 millimeter when you go down, when you drop into the chamber, but like it took a little bit of time for me to drop. So for a second I thought I'm doing the wrong tooth. So just, you know, make sure you are doing the right one. And one point to really keep in mind is that obviously, as I said, draw the outline first, and then you know, the mesiobuccal canal is usually under or mesio to the you know, the buccal groove that you have, and then distal buccal groove is distal to that groove. Distal buccal canal is distal to the buccal groove. So you know, in dental key they really explain that really good. But you know, I finally found the canals, but I would really suggest you get one of those endo teeth, at least like get 2 from Acadental, so that you can practice making that axis opening, especially if you are like me and you don't do root canals regularly. You really need to get a feeling of like how it is and where they are, how deep you need to go. That really helped me. So you just make sure, like for me, when I found the canals and cleaned up all the bags, when I was putting my endo explorer, it wasn't going like 100% straight to the canal. It had a tiny bit of an angle, but if I was going to remove more tooth structure to get the access opening, like somehow that you know, it goes completely straight to the canal, then, you know, I would undermine those criteria for how much tooth structure we need to leave at the marginal ridges. So I thought probably that's more important. So let's not remove more tooth structure, and it's okay to have a little bit of angle, like opening to the canal. So I hope that makes sense, what I say. So that's for endo. So basically, after you clean up the wax from axis of number 14, and you can feel that opening to the canals on number 14, just MB1, you don't need to find MB2. So mesiobuccal, distobuccal, and palatal canal, as long as you find these three and it's easy to find it and it's clean, then you are basically done. So just make sure you do all the measurements based on criteria sheet that Adex has, and mydentalkey also almost has all the right numbers on it. It was a little bit different, so just I would say double check it with the Adex criteria sheet. And that's with the endo section. After, so for each of them you do separate rubber dam, and I would suggest you isolate many teeth so you have big working space. Okay, and so you do one rubber dam for number 8, you do another rubber dam for number 14, and after like you are done, then you let them know that you are done, and they just mark that you're done. And then what was the last one? Then it was the perio section. So obviously for the perio you don't need any rubber dam. So obviously I didn't practice for perio because, like, to me scaling is very easy, but honestly it wasn't that easy because how the buildup on the teeth felt, it was kind of different from natural teeth. It was like harder to remove. So basically I thought, like, at the beginning I would think that I will be done in 10 minutes, but that took me 40 minutes. So basically they will give you a tooth number and like a surface, then you clean up that area. But it's so easy to move the gum kind of with your explorer to the side and directly actually look under the gum and see where that, you know, calculus is, and you just scrape it. And, you know, I could see in some areas there were pieces of buildup still sticking to the tooth, but, you know, when I was like touching it with my explorer, it was kind of smooth. But, you know, those like bigger ones, they need to come out for sure. Like, you need to clean up. But I feel like even after you clean that up, there is some sort of staying on the tooth surface. So it's not gonna be super clean. It's not gonna be like the teeth that when you clean it, it's 100% gone. You can see some residue of, you know, that buildup on the tooth. But it wasn't too bad, honestly, that part. And then we go for the resto section. So resto was like very stressful for me because although I have lots of experience with resto, But as you see, like the measurements are really, really detailed. So in real life, obviously, you don't work like that. And for resto, I would say the most important thing is to use number 330 diamond bear. So that's the most important thing to me, because that's like very small, very precise. Like with the bigger ones, you cannot get the measurements that you want. So we don't actually use that in our office, and I actually started to like it after this exam. But you know, I had to order it really last minute, and I ordered one from Stevenson website, and it was very expensive. I ordered one, and because I had to pay for the shipping for just one bear, it turned out to be $50. It's very expensive, but it definitely worth it because I didn't have that bear. So, and then there was one other person making, obviously watch the Stevenson videos for resto, but again I couldn't fit any fender wedge. Like I couldn't separate the teeth, so I had to break the contact without any protection on the tooth beside it, and that was very stressful. And I don't recommend using enamel hatchet, because one time I was practicing and I broke part of tooth with enamel hatchet. So I don't really recommend that. I would suggest you just go very, very slowly. And what I did was, after like I just left a tiny enamel shell, basically without the bear, like a handpiece being on, I pushed with the bear on, like I pushed it to the side and broke the contact that way. After the contact was broken a bit, I could fit like a fender wedge. So that's how I did it. But about like how big the size of the preparation be, I actually saw a video that I really liked, so I can put that link for you. So basically the doctor that was showing that, he, like for the posterior teeth, basically he would floss between the teeth, like he would go down and then bring the two pieces of the floss from the side, so you could see where the contact area is exactly. So he would mark it with like a blue articulating paper, like I did it with the pencil. So I marked like where the contact was exactly, and I made a box exactly based on the measurements. So, and the measurements I got it from Adex criteria sheet. So that one was for the posterior teeth. For the anterior teeth, if I'm not mistaken, he was like, find the contact point and then like start from like lower half of the contact area and then make a box like 2 millimeter, and then you look at the criteria sheet. So yeah, basically at the beginning they show you an x-ray, you diagnose. So at the resto day, when they give you the typodont, you basically can tell which tooth is it, almost, because the color of those teeth are different, because they are different type of teeth. So for us, number 7 and 8, they were different color, as well as number 29 and 30. So all those 4 teeth actually had cavity in reality, but you would ask one instructor to come and then you would do a diagnosis. So each instructor, they had different x-rays. So for example, I got a different instructor, and then the cavity that I got was basically number 30 MO and then number 8 DL. And then the person sitting beside me got another tooth. Although, you know, basically a hair typodont was the same, those four teeth, they had different colors. So my guess is that all the teeth, they have same cavities. It's just your luck what you get for like actually doing it, because you know you keep the x-ray with yourself too, so they know that which you know x-ray they give it. And you know the cavity was super obvious. It's not something that you would even think twice. It's so obvious that you know you could see the cavity from like other chair, like somewhere else. So that's not a thing to worry about. Or I cannot know like which tooth has the cavity. It's very obvious. And then actually the rubber dams that the school gave to us, the quality was really good. So it was actually much easier to place those rubber dams than the ones that we have in our office. And then basically my prep on number 30 turned out to be big. So for the occlusal depth, I would say I went about 2.5 millimeter. And then some people would ask like how much. Actually there was like a guy in our exam, he asked me how much the box should be, and I was like, it depends on how big your cavity is. So basically you go as deep as like you have enough gingival clearance, but not too much based on the criteria sheet. So you don't, like after you break the contact, you don't want to see too much of the gum in between the two teeth, because I believe it was just like 1 millimeter of clearance that you needed to have. So I would say when at initial point I had like a 2.5 millimeter of the occlusal depth, and then like my box, I would say it was about 1.5 millimeter lower than that. So at that point I checked, and then there was cavity remaining on the axial wall, axiopulpal line angle, and then pulpal floor on the mesial part of it. Yeah, on the mesial part of it, and then a little bit of cavity on the distal. So basic. And then one more thing to say is that you know these teeth, first of all, it wasn't too hard to differentiate between the good enamel and the cavity. So I was very worried about that oh my god, like how I'm going to really know if there is cavity or not, because you know on the teeth that I practiced, it was kind of hard to differentiate. It was not like real tooth that you know it's easier, but you know on these teeth you could basically feel better. So you could see, not see, but you could feel if actually there is a tug back or not. So basically these teeth, they have enamel attached to the dentin, and you know it's like a plastic tooth. So basically there is like a glue in between the enamel and dentin, and that glue is pink. So it was very honestly confusing that you know if I see a stain and it's on you know DJ, and if it's pink, like should I remove it, should I not remove it, what should I do? So I anyhow, like there was like a big pink stain on the gingival floor of my box after I did the initial prep, like to the max level almost. So I did like 5 no, 4 modification requests. So I asked to extend my axial wall and reduce a little bit of axial pulpal line angle and deepen my pulpal floor on the mesial beside the box. And then I also asked, I want to remove the stain on the DJ of my box. There is a pink stain, but it's not penetratable. So I sent those modification requests, and I wasn't sure if I should include that pink stain or not, and all of them, they were accepted. So looks like, you know, it's a good thing that I included that. So I got the I asked the instructor, he came for the modification request, and then they took my typodont. It took like 15-20 minutes. It wasn't too bad. They brought it back, and you know, after they brought it back, I just start to extend my preparation. Then after like I was sure that there, and thank God I didn't get into do any you know, pulp cap or anything like that. I was super happy because I didn't feel like it, honestly. And then after I felt like I cleaned up everything, but just keep in mind that I tried to remove that stain from the box, that pink stain. It got better, but it didn't go away, and I was like, I can't go down forever and reduce that more and more. It's just a pink glue that is there. So basically it became better, but it didn't go all the way. But like when I touched it with my Explorer, it was very hard. So I was like, okay, so I will just give it to the marking station. So I sent it for marking. They gave it back to me after like 20 minutes, half an hour, I don't remember exactly. So then I started filling it, and then the filling part was very annoying, because one criteria that they actually have is that the contact needs to be visually closed. So basically one of my friends actually just few years ago failed this exam because like his contact was open. So I was really hyper focused on that, so I wanted to make sure my contact is not open. So basically you can, it's very weird, in reality it doesn't really happen. So basically you can, like after you fill your tooth, you can floss and snap, like it has like a good contact with the floss, but when you look from the top you kind of see that it's open. It's very weird, but it actually happens. So I filled the tooth, and then like it wasn't as close as I wanted. So I was a little bit stressed out. I drilled out my box one more time. I filled it again, the same thing, and I burnished it. So I don't know what was happening. And then the third time, maybe I was super nervous, maybe like, you know, maybe even if the second time I just gave it to them, I would pass anyway. But you know, I was really worried about that part. So the third time I removed that, you know, I drilled out the box again, and I was feeling it. I had my ring and everything, clamp and everything, and then they said that, oh, time is over, like put your instruments down. I was so stressed out, and I thought like we have the whole time to finish the exam. So like I just, like with my composite gun, I pressed like the composite out of it, and I just pushed it, but I didn't pack too well. But then I realized that there were some students that they failed like before, like one part of the resto, so either posterior or anterior, and for them that 3.5 hour was over, so they have to finish. But for us that we had that 7 hours to do both, like we didn't have time limit to do like one part of it. So I was really pissed off because like I was so stressed out, like my hand was shaking, and uh, I I didn't feel good, and I was so mad that I was like, whatever, I'm not gonna drill this out again, and I'm just gonna polish it. And at that point I was like, I gave up. But anyhow, and I was like, probably I have a void or something because I didn't pack it. But I was like, okay, let's do it. And then I just polished it and I gave it for marking, and I was like, okay, so I will probably fail this part, but at least I can do the anterior part okay, and at least pass that one. So then I started with the anterior one, number 8. I did my like outline drawing on the tooth. I drilled it out, and then I had to do 2 modification requests. I think one of them was to extend it toward the facial, because I had cavity on the facial, and also I had that kind of pink stain on the DJ again. So I was like, let's remove that. Oh, and I had to extend toward the axial, like toward the paw. And both of the modification requests were actually approved. So they accept that, extending for removing that pink stain on the DJ, although it doesn't have a talkback. And on one of my modification requests that I had, I was like, possible caries. So, but when instructor came to me, it was like, are you like asking us to tell you that it's a caries, or you are sure? Then I realized that I should cross out the possible. So you should be sure that it has a talkback, so it's a caries. So don't like act like you're not sure, so you are asking them. So that's important point. And then they approved my modification request. They gave it back to me, so I removed that sticky part. And then I extended to the facial to remove that stain on the DJ, but that stain didn't go. And then my facial wall was so thin that I knew that if I go more, like, it would break. So I was like, what, it's hard, I will just leave it as it is. So I sent it back for marking. They marked it. So you never know if like you fail or pass, you just go to the next step. And then it went to the part that we had to fill the tooth. So that part was super easy, and I would suggest for polishing it you use one of those discs, polishing disc, and it worked really good. It looked really nice. So yeah, I was happy with it. And basically the day after, just I got a text that your results are ready, and I checked and I passed. So I'm super happy about that, because I at least expected to fail the posterior resto, but I'm so glad that I don't have to do this exam. So hopefully you all get ready for it. If you had a question, you can ask me. I'm not a pro at this, but I just got prepared for it like in a month and a half, and I basically practiced like six restos and 3 anterior endo, 2 posterior access. So I didn't practice that much, but at the same time, I'm like, practicing it every day, like, but on real people. So it's super normal to be nervous about this exam. I honestly can feel like, students who are just graduating, they would be very stressed out about this exam, and that's totally normal. So good luck, and I hope my 1 hour of talking help you somehow.